Hello, everyone, and welcome to Bikinis After Babies. Thank you so much for joining us today on our 20th episode. I am, of course, one of your hosts, Mandy or Sean, and as always, joining me is your beautiful, other stunning host.
Thanks, Mandy. You're so sweet.
I'm always coming up with new words now.
I know,
now it's
you
like
are.
fun.
You're so descriptive. I appreciate it. Well, thank you everybody for tuning in. I'm so excited about today's episode. You probably saw in the title, we have a very special guest with us today. Today's guest is Patti. She is a doctor of physical therapy. She is a mother herself who obtained her bachelor's of science in sports medicine and athletic training in 2000, her master's of science and administration in sports training in 2002, and graduated with her doctorate in physical therapy in 2009. Tina currently specializes in pelvic floor therapy, helping her patients with a variety of pelvic floor issues from diastasis recti, urinary incontinence, pelvic pain, and sexual dysfunction. We are so excited to have this wonderful expert on our show today. Welcome to Bikinis After Babies, Tina Patti.
Welcome.
Hello. Thank you guys so much.
Thank you for joining us.
We're really excited to
Without a
have
doubt.
an expert and somebody who specializes in a women's health issue, and something that we as coaches actually talk to our clients about quite a bit. And we found out about you through one of our fabulous clients.
Yes.
So why don't you tell us a little bit about your background and maybe how your passion for this side of physical therapy started?
So my background started, and it was funny as you read through all of the education. I'm like, wow, spent a lot of time in school.
Yeah, that's what I thought too when I was writing it out. I'm like, this is
I
a
was like, holy
lot.
cow. So I'm sorry you had to say all of that.
No, that's impressive. That's amazing.
But I got my start when, even in high school, I had that ACL injury that required surgery and had to go through PT, all that fun stuff. And I fell in love with athletic training. So with athletic training, it is physical therapy, but for a very specific population. So I was an athletic trainer for about 8 years, and then went back and went, okay, I love athletic training. I love that higher level of function, utilizing the core, helping people get to that next level. But it doesn't really pay the bills so much, and really long hours. And so I went back to PT school, went on with sports medicine. I was one of my former company's throwing specialists. And in the Midwest, it was really hard breaking into that sports realm because I'm a girl, and they think boys are the only ones that can teach you how to throw. And it wasn't worth the arguments. And then when I had my daughter, I had a lot of pelvic floor dysfunction. And no one helped me. All my other physical therapists are like, oh, that pain will go away after you have a kid. Okay, well, what until then?
Yeah.
So that's where my journey kind of started. Is I had a really hard time my third trimester. And in that infamous fourth trimester, I was stuck into pins for 2 weeks.
Wow.
No.
And you had nobody to help you either.
No one would help me. So I finally went to my OB and there has to be something. And she's like, all right, well, let's just try some pelvic floor physical therapy. Let's see how that works. I was so embarrassed I would not go to the company that I worked for, even though it had pelvic floor therapists. So I didn't want anyone to know.
Yeah.
And it took me 3 sessions. And that was
Wow.
so I then went to my former company and I went, all right, let's sign me up for these classes. Let's get it going. I get it. And now let's get other people. So
Wow.
I completely rechanged my practice. So I credit my daughter to one, changing life, because I could do. And then because of her, I completely changed my career.
Yeah.
And it's so cool.
That's awesome. So
I can imagine how many
long
people
ago
you
was
help
that?
now.
Oh, sorry. Go ahead.
What was the question again? I'm sorry.
No, so take me back, when that started, what year did that kind of begin that you
That was
had the issue?
2013, 2014.
Okay. So
And so
10
I
years then
got
you've
all
been
my-
really specialized in that area. That's
Yeah.
awesome. So maybe
And-
let's back up a little bit because pelvic floor dysfunction, it is a big area. There's a lot of different things. So maybe some of our listeners are not sure if it's something that they're struggling, maybe they know that they are, but what would you typically see in somebody who is struggling with issues with their pelvic floor?
A lot of the patients that we see, or the ones that are more prone to get to us, have a lot of urinary issues. So it's I can kind of get to the bathroom, but not quite there, and I might have a dribble or two. Or I'm okay most of the time, but when I go into the gym and I try some jumping jacks, it always fails. Legs open, pee out. And the running. And it's a lot of those lower impacts that just the dribble. We see a lot of that. Also, I have several patients right now that round ligament pain on that lower right side when they're pregnant, and then they quit working out because this hurts too much. It's a lot of pregnancy, a lot of postpartum, and luckily enough, right now we have a lot of young ladies that are coming in because it's getting to become a little bit more common. And they saw something on TikTok and they're like, okay, my mom complains about this, my older sister complains about this. I don't want to complain about any of that. So what do I need to do proactive? Starting to get a couple.
Yeah, that's interesting. Just I think more awareness around it. And I think when we spoke on the phone, like you said, like it's not normal to pee on yourself.
No.
Why do we think it's okay? Like, and I remember
Right.
like saying, no, I'm not going to jump on the trampoline with you guys. Like we go to Sky Zone. I'm like, I'm good. I'm just going to pee on myself. So I'm not going to like, I don't have to pee on myself. Like there's things that you can do, right?
There totally are. And I think the reason we think, oh, that's okay, is because that's what our moms told us.
Yes.
It's a normal part of aging. Because that's what their moms told them. Because back when our grandmas were around, there really wasn't anything.
Right.
The pelvic floor therapy has been in the U.S. since the 60s. But everything starts at those bigger coasts, and then it slowly trickles its way in. And there's never enough therapists in whatever city you live in. There's not enough for the population.
Right. Yeah, that's really interesting. Yeah. And so I think like more awareness about it, but like kind of thinking back to when we had our functional health specialist to come on and just talk about women's issues, like really women learning to advocate for themselves and be able to like solve these issues that they can be more optimal. They can, have better, pelvic floor engagement. They don't have to, leak and, I can't do squats because, I might pee. So like, do you typically see that quick of a recovery? Like you mentioned that it was like 3 sessions and you were, doing a lot better with those issues, or are there some things that are more complex that take longer to heal?
Sometimes it is more complex. I think I was really lucky because I got in so close to that labral injury. So my injury hadn't been there a while, hadn't adjusted. Most of the times, it usually takes between 6 and 12 visits. We typically see a patient 1 time a week, between a half an hour or an hour. It just depends on kind of what organization you go to. Really depends on if it's between a half and an hour. Most of my ladies, I'm lucky enough where I can see for a full hour. And it's usually 6 to 12 weeks. And I know that's a huge range, but it really depends on what are we trying to get. So to reduce that, I'm leaking on the way to the bathroom. That's usually done in like 2 or 3 weeks.
Yeah.
And then they get a taste for it. They're like, okay, so you fixed that. Can you fix this hip? When I do jumping jacks, can you help out with that? And then we just treat the person globally. But the dribbling to the bathroom, usually about 2, maybe 3 weeks. Working on that breath, it really just depends on what is your body awareness? How much do we have?
That's incredible that it happens so fast. Like, I think that is so fast because if you really think about it, people will deal with that for years and years and years, decades. That's just a part of, like we said, it's a part of aging. It's a part of childbirth. You chalk it up to, I gave birth, so I can't jump on a trampoline. I can't do HIIT training. I can't jump around because I'll leak or something happens. But if you go to somebody and say, oh, well, you can fix that dribblage or that, issue in 3 weeks, 6 weeks, that's so fast. And instead of dealing with it for so many years, like you can address these issues. It is not normal. It is not normal to do that. And the fact that you can do that is fascinating. I didn't know you could do it that fast. I just assumed
it really
it'd
can
be like 6 months.
Nope. And that's the really cool part is once you can tell a person, try this, not that, And the biggest part, and I think the one thing that is a common denominator through most of our patients, it's not have you had kids, have you not had kids. I had one patient come to me a couple of months ago. She's like, I broke her. I've used her entirely too much. She's broke and I did her in. I'm like, no. Doesn't work like that either.
Like she broke her vagina? Is that what
She thought she
said?
did. She's like, I've just been very active my whole entire life. I've always had multiple partners and she just broke. I'm like,
Oh my
no, that's not it.
Gosh.
I love how some women, how we all just describe our body part, just how we describe our bodies sometimes is fantastic.
That's so funny.
And then I've had another woman, like, I've strange enough treated several nuns. And they've come in and going, I never used her, so she just retired early, didn't she? I'm like, no, that's not the case either.
She retired early.
That's so funny.
So, like, the number one factor is when we are stressed, where do you hide your tension? We either get TMJ, we get migraines or tension headaches, or you get incontinence because you're bound to hide your somewhere. So we have to tether that out. When you feel stressed, instead of clenching and letting everything in, how about you meditate? How about you work on some diaphragmatic breathing and move instead of sit down and do things that aren't great for our health?
Yeah.
But it's a personality
so
profile, strangely enough.
Yeah. Well, yeah, I think we're just sort of like, as women and moms, like taking care of everybody else, we're just sort of like, we need a quick fix to just get better so we can hurry up and take care of everybody else, or we brush things off. Like if our kids have a sniffle, like we're right on it. But if it's our, issue and it could be something that's really bothering us or like really impacting our lifestyle, but we sort of just, put everybody else first and then these things carry on. Do you see where like somebody is maybe dealing with this dysfunction for a long period of time and it takes a while to like kind of get things back to a more optimal range?
It can. And even with when people have dealt with for a while and always putting people first, I actually see a lot of teachers and a lot of healthcare professionals because of what you just said. Someone else is always more important, and we always are the last to care for ourselves.
Right.
And I know it sounds really psychological, but I think of that as lots of generational training. And it's educating women to say, you don't have to do that, and to put in the work. And it's a lot of just remembering to do the exercise. Because let's be real, when you're working on your pelvic floor, you don't necessarily need any extra equipment. You can do it sitting down. You can do it right now as we're doing it. No one's going to know you're doing anything.
Yeah.
But it's actually just doing it. But the people who are more inclined to make that positive change, they get better faster. And the ones who just kind of resist and like, I don't have time. I've got this person take care of this person. Like, but we all get in the car. We all drop the kids off, or we're all running the Uber for our parents or our grandparents. Like, anytime you come to a red light, do a series of the exercises. When you're waiting in the drive-thru for the food that you probably shouldn't be eating, do your exercises. You just fit them in. And then
So
those
you're
are the
talking
ones that
about
are
like Kegels then? Or is there something? Okay. But I think you said people are doing Kegels wrong, right?
Yes.
Okay. So tell me about that.
So when most people do Kegels, unfortunately, because no one ever told us what to do, they just said, do your Kegels. And we're like, okay, well, Kegels means squeeze the nether region. Most people are actually stopping gas from passing, and they're not stopping urine from passing. For some reason, we understand our rectum, but we don't get the vagina and the urethra. So you have to give a couple of cues depending on that person to help find what do those front muscles feel like. Yeah. So the analogy that I use that makes a lot of people laugh, if it's too much, please let me know. But
I doubt it. Women, I highly doubt it.
Probably not for the show.
I tell my women, like nothing's going to be off here. I'm like, think of the very front part of your labia. Think of them as elevator doors. Why? Because an elevator door is gentle. If an elevator door can't close, it doesn't force itself closed, and it just kind of kicks back. So imagine the front part of your labia as gentle elevator doors, and imagine pulling your labia towards themselves, and then let them go.
And
if you do that, it feels very different than the back.
Yeah, that's so different. I feel like everybody just tells you to, like, a Kegel is just hold your pee. Like, imagine you're just holding your pee. But I think
Hmm.
that that can be like uncomfortable too. Like I always felt I was doing it wrong, so I just kind of stopped trying because I'm like, well, that does not feel right. But
Yeah,
that's a really interesting way of explaining it. I think that's more doable, definitely.
and it is, and it gives your brain a target because the urethra is such a tiny tube. Your brain doesn't know where that is.
Yeah.
The back openings get way more action than the front one, unfortunately. So we all just kind of kick back those back muscles, and a lot of it also even has to do with posture. If you're slouched, you're gonna hit that coccyx and the coccyx way more than if you're sitting up front, finding the front muscles. So sometimes it's our posture that really kind of drives that.
Yeah. That's so interesting. So then what about like vagina weights? Like are those still a thing? And do women use
They
those
are
to do
still a
better
thing.
Kegels? What do you think
I
Um,
about those?
totally forgot about this. Like as soon
You
as you
forgot?
said
oh
it, I was
yeah,
like, oh my gosh.
I I have like this little arsenal of samples that can make a lot of people blush, but it's fun because in both my offices I have like dilators. Sorry. um, but no, I actually have a set of Kegel weights in the office for people to see. And it's like, yes, Kegel weights can work, but the problem with a lot of pelvic floors is the muscles are really tight and kind of weak. So we have
Oh,
to restore that range of motion. Can the muscle fully relax before it can fully squeeze? If your muscles can relax to the best of their ability and you're still having some incontinence while you're working, then yeah, I actually do recommend some of the Kegel weights to my patients with stress incontinence.
yeah.
And it's because sometimes we're lifting weights. And when I am spotting with a decent, well, my version of a decent rack, sometimes there can be. So yes, I will use some Kegel weights. I use some dilators. There's different tricks of the trade that we use. But if you're going to do Kegel weights, I would really recommend go into a pelvic floor physio. Make sure you have that relaxation first, and then yeah, go for it. Please make sure you have good motion. Yeah, it's fun.
Yeah. Because those muscles, that's interesting that the muscles can be tight but like weak at the same time. That's really interesting. I think that that's like probably in any muscle in the body as well.
It is, and they are really similar to the hamstrings. The hamstrings will often splint because the glute max and TA aren't doing their job, and so something has to work a little bit better. And it's the same thing with the pelvic floor. It's going to get tight because it's weak and it's just trying to shorten itself up because the brain thinks that does better for some very strange reason.
Right. So I wonder if like
Fascinating.
some of your patients like when they might initially like come to you for stress incontinence, but do you often find that there's other things that they're coping with that they didn't realize were related to the similar issue?
Always. The
So what
hips.
are
The
some of
hips
those
are
things?
often the big culprit.
Okay.
So if the hips are weak, the pelvic floor sits in the middle going, I got you guys, don't worry about it. And it's often that posterior hip. So the external rotators of the hip are a big piece of that. Glute weakness is also a big piece of that. Lower abdominals, the transverse abdomen, especially if a woman has a DRA, that separation of the abs, one of their canister muscles is insufficient. So another muscle has to substitute to help out. So it's kind of our job to find out that domino effect. If the pelvic floor isn't working, why? Is it because you're a little stress bucket and you hide your muscles there? Or is it because other muscles aren't working as efficient as they should be? So it's just substituting and trying to do the best we can to help out the team. So we always have to assess the team. Are your hips moving correct? When you're running, that's 5 times of your body weight going through each side. Well, as you're doing that, if you can't do 30 single leg squats, then your pelvic floor is substituting and you're going to leave. So it's
Yeah.
always stepping back and saying, you are a whole entire person. Where is this weakness?
That's really interesting.
That is.
It's
I just
really
never thought of it
fun.
like that.
I bet it would be, like just because everybody's so different. And then I think like we're all just sort of like, oh, you just have a baby and then, your job is just to lose the weight afterwards. But when we think about everything that goes on in your body and just how your entire anatomy shifts, like Of course, things are going to come back together and they're not going to be exactly the same as they were before. But I can see how if you are, ignoring things like, your posture or like, glute weakness, and maybe you're focusing on like just having a flat stomach, but the reason why your belly is pooching out is because of a series of like other things going on. So I think that one of the big reasons why I wanted to have you on today is because I wanted to raise awareness about some of these issues. Like, again, like for us, we see women that are coming in for weight loss, but like, we uncover all sorts of other issues that are going on. And they might think that there's an issue with their metabolism, but then we're seeing like, well, let's back the train up. There's like all these other things that are really just not optimal. So I imagine it's the same in your line of work where it's like this one big thing, but then there's like all these little things that we can improve so that the entire thing is better.
And it's probably a lot of the same stuff that you guys see is a woman will come in, she's like, I've really been working my abs. And I don't understand why my pelvic floor is mad. Well, what have you been doing? Oh, you do 300 sit-ups a day. Not really great for the core. So every time you sit up and you're going, you're pressing down into your pelvic floor. All of that pressure, there's a lot of issues there. So some of my women, we actually can get back into doing like a regular setup, but we have to teach the transverse abdominis how to work first, and then teach the rectus over the top how to control better. But it really is kind of unprogramming the fad diet, the fad workout, and saying, no, this is the tried and true method. Here's what science tells us, and not trend. And it's kind of unprogramming a lot.
I feel like so many of, not our clients necessarily, just like so many women, it's just, you go so extreme. You don't think about these minor little things. You don't think about your posture. You don't think about how long you're sitting. You don't think about your stride when you're stepping and how you're holding yourself. And you don't think about that maybe for a few weeks, but like, oh, this is over a course of years and decades. And like you said, how sitting for so long and the strides and everything that we're doing, how it just wears and tears and wears and tears. And it's like that dribble becomes worse and worse and worse, and it becomes harder and harder. And we just put ourselves on the back burner for so long. We don't think about how this is such a form of self-care, and it really should be talked about. And we really should think about our posture, and we really should think about these things because they are important, and that we are important, and we should put ourselves first so we can take care of ourselves, so we can, be the great mom and have the great energy and like have all of, the buoyancy for, when we're 60 and wanting to jump on trampolines.
It is. And it's so strange. I'm not sure if it's the Midwest. I don't know if it's America. But if a woman is taking care of herself and she's got kids, some people actually really just consider that being selfish. Well, you should be spending that time with your kids. And it's really hard to unprogram women to say, no, you're actually taking care of yourself. And if you're eating correctly and you're working out correctly and you have a good lifestyle, your children see that. And that's the role model that you're projecting.
Mm-hmm. Yeah, 100%. We talk about that all the time, just like how that narrative just like needs to go away. Because we always say like when you're taking good care of yourself, like you're free of that worry of like, oh, there's something I should be doing. Because we all know like, okay, I really shouldn't be eating this. Like, I know this isn't the best choice. I know I'm going to feel if I like, eat birthday cake for breakfast, right? And like that feeling and that guilt, like we can eliminate that from being in our lives by taking care of ourselves. So, but I think it's just like we're sort of like, and I agree with you. I'm from Canada. It's a little bit different there, and at certain parts of the country, there's just different mindsets about self-care and what that looks like. But definitely, women still sort of battle with that of like, am I being selfish by like taking time out of the morning to get my workout in? Well, no, I mean, taking care of you is taking care of your family, because, everybody needs your support and you to be strong and healthy. So doing that for yourself is definitely not selfish. And I don't even think that anybody really thinks that. We are just putting that on ourselves and feeling like that is, I should put my priority somewhere else. But I think, you can just see probably women that they come to you and they've been battling with something for way too long. Like, we talked a little bit earlier about like sexual dysfunction and pelvic pain, and like that causes a lot of stress on relationships and what that could be like. But, are you, doing something about it because you're heading into a divorce because now, you've disconnected with your partner, but all of that thinking about just like, well, I didn't put myself first and deal with this, this issue that can be treated.
And that is another thing that we do see a lot. And I think the women that we see with more sexual dysfunction, at least in the very small sample population that I have, is the more conservative a person was raised, often the more sexual function that they have. And I'm not blaming parents, I'm not blaming religion, but it's how we make that association. So some of my patients are like, no, I waited till marriage. This was important. This is my belief structure. But now I can't. And it's because we were taught, don't look at it, don't touch it, don't think about it. And luckily enough with each generation, we're just getting more educated. And yeah, you can think about it. Yes, you can touch it when appropriate. And telling women that no, you can do these. And then giving them tools. And literally sometimes it's tools like dilators to help the vaginal walls kind of relax a little bit and allow you to work up from a size smaller than a tampon to the size of a part, and teaching those muscles it is okay to allow something to end.
Yeah. That's interesting. I think that might be something that some people just have a hard time kind of talking about, and maybe there's a lot of shame around it too. And, after having, if you have, a difficult childbirth and things are just not the way that they used to be and, don't feel the way that they used to, sometimes that could be like a hard conversation. So, and I can just tell from your energy that you're like very easy to talk to. I'm sure like patients feel like completely comfortable opening up to you, but I imagine there's, people that just wish that they had someone that could help them with their issue that's really hard to talk about.
Yes. And I do encourage anyone, like there are different sites you can go onto, at least in the US, you can go onto a site called Herman and Wallace, and you can actually find a pelvic floor physical therapist in your area. So I always encourage anyone to go onto that site, see who's in your area, talk with people, throw out on Facebook, hey, who did you guys see? And start there and find someone that meshes with you. And just because your first pelvic floor therapist didn't jive with you, okay, I'll acknowledge that. Sometimes I don't get my patients as well as I want them to, but then I at least know a person that I think I could match them up with, so I can say, I don't think our toolbox are working, but I want you to go see this person because I think that person might be able to help you out a little bit more. And it's kind of the same thing with a counselor or with your doctor. You're not happy with your PCP. Why are you staying with them? Find someone that helps you. And it's constantly pivoting to make sure you advocate for yourself and find the things you.
Yeah, we talk about that quite a bit with coaching. Like, like we have a team of coaches, Momshell Method Fitness, and there's going to be some clients that jive really well with me and my personality and the way I coach. And there's going to be some that don't. And but at the same time, we have other coaches. It's like, okay, well, this coach might fit you better or work with you better or, your lifestyle, whatever it may be. But exactly, it's what is going to help you. And yes. I feel like it's that communication. It's talking. It's, hey, this is how I feel. This is my comfort level. This is my discomfort, and figuring out what works best for, the patient or the client, and being able to get them like the best help for their goals or whatever they need. So that way we can like help them, but definitely find what works best for, them.
And it's also even with what you guys do and what I do, there has to be a serious level of trust there, because my patients tell me a lot of stuff. And so I'm like, I need to blog on some of the stuff I hear, like the life and times of pelvic floor therapists and stuff.
I bet,
because I talk about pee, poop, and sex all day long. And it's interesting that then there are times where I have to like kind of see where does this patient sit on that like level, and where do they jive, and how reserved are they? So I actually have to reflect what my patients do a lot. But it is helping people feel comfortable, because no one wants, except for me, no one wants to talk about pee, poop, and sex all day long.
Right. And it's funny though. Yeah, because once you break that down and people your patients talk to you about it, just like our clients, I'm sure it's like this whole world opens up, right? And all of this like just stuff comes out. And it's funny you mentioned that, because I try to talk about that in my household. Like I'll talk about poop all the time. I'll be like, talk about digestion. And I swear my boys are like, do people really like, you talk about this a lot? I'm like, it's so important. It's so important. You guys don't understand.
Yeah.
And it's also one of those things. I was raised very rural. It was very conservative. Mm-hmm. You didn't talk about pee. You didn't talk about poop. And you definitely didn't talk about sex. So now that I do what I do, my mom will look at me sometimes and go, where did you come from? Like, I don't know. Sorry, guys.
Right.
And I laughed. My daughter is 9. She turned 9 just before Christmas. And sure enough, on her 9th birthday, we're sitting in Chipotle because that's what she wanted for her dinner. And hey, why not? And she's eating her little taco and she's like, Mom, what's your period and why? Poor lady at the cash wrap like dropped something. And I look over and she's like, ooh, how are we going to talk about this? Right in the middle of Chipotle.
Right.
And I busted out my best version of it. So you just be candid and be honest. And it works with our own family and with patients and clients.
It's our body. Like, I feel like if my daughters can't come to me and talk about things, that are happening with their body, like, I don't want them to just keep it in, but I will
Right.
say, we're probably similar in age. And, when my daughter started her cycle, I remember asking my mom, like, what was it like? Like when I started mine, was it like this? Or, just sort of trying to compare, like, is this the experience I had? And my mom goes, I don't know. We didn't talk about that. We didn't. Like, Brooklyn and I talk about this all the time. We talk
Yes.
about, just everything she's experiencing in a very open way. And I think a lot of it is to do because I'm in women's health and, I'm a nurse as well. So, but it's just, I think even just in that shift, I mean, I grew up in the 80s and even then we weren't really talking about that. I mean, it was just, very like, it was a secret. I remember like hiding my pad wrappers so my brother didn't know I had my period, like stuff like that. And I think, it doesn't mean that you don't have any class if you can talk about your body, but for some reason, I think some people still really battle with that of just being like, oh, this is TMI, but like I haven't gone to the bathroom in 5 days. I'm like, it's TMI, like
There's
that's
a problem
you need
with
to
that.
do something,
Right.
So I think
There's
just
a problem there.
yeah, like, and that's another reason why I think it's important to have you on, because I think like this is all a huge piece of fitness too, is like, the normal function of the body and the way things should be. And no, it isn't normal to experience, 5
No,
days without a bowel movement or like peeing on yourself when you do lunges,
no. With one of the classes I took, when we really got into the bowel and rectal stuff, it was so funny because our instructor gets up. I think there are like 30 or 40 of us in this class. And she's like, all right, everyone put up their hand when you poop daily. And seriously, like 80% of the class put their hand up. And I'm going around going, what's wrong with these people? And she's like, who poops every other day? And I'm still the one going, I just pooping so much. And she looked at me, she's like, you, how often do you poop? And I went, I don't know, like every 3 to 5 days. She's like, what's wrong with you? And I went, I don't know. Come to find out, I had celiac, but we didn't know it. I'm Italian. I eat pasta.
Oh
I
my
eat bread.
gosh.
But I had no idea that was so toxic in my system. And I had been doing this my whole entire life. So sure enough, for me, I cleaned gluten out of the diet. I cleaned a lot of sugars out of the diet. And what do you know? You can poop regularly. So you don't
And
necessarily
I
have
bet
to
you
poop
felt
every
fantastic.
day, but you got to go every other day.
Yeah. That's a very a big sign of health. When we ask our clients about digestion and they're just like, oh, just like for my whole life, I've kind of been like an every 3 days. I'm like, what? Like, and we know on our side of things, like just, estrogen collects in stool. Like you have to move your bowels every day. Like it isn't good to, to keep that in there for 3-4 days.
Oh.
But some people just are like, they've never talked about it. Nobody told them that it was abnormal. I mean, probably even just like you see women that deal with bloat, and like kind of thinking about when we talked earlier about holding stress. Do you find that a lot of women hold a lot of their tension and stress in their bellies and then subsequently will like develop issues with, either bowel issues or bloat?
It can be. And I think because when we're younger, once again, I was raised very country, very kind of southern, where I was taught you suck in that belly. Tuck that belly in. No one wants to see that. So I was taught to splint. And I've also got bust. So I was taught to hide my bust and splint my gut. So I was taught to be like this funny little C shape. Well, that doesn't really bode well for digestion. You actually need to have a diaphragmatic breath. You need to expand the gut and contract the gut and use that diaphragmatic breath to really help that peristalsis. And when you clamp on your gut and you clamp on your pelvic floor, you just took out the shuttle system and you just closed the door. So a lot of it is telling people you have to find whatever your relax is. Get on headspace, get on calm, find what brings you down. And I even help a lot of women with vagus nerve retraining, down regulation, Our vagus nerve is a fight and flight nerve. And if it's constantly being attacked, you have to help bring it down. And there are some exercises that help out with that. But you have to understand and recognize, what is your personality type? Where are you hiding? And after a while of being bloated and not going to the bathroom, then we open up the door on, do you have SIBO? Do you have other bloating issues because you've left the poop simmer in your gut for too long, and now we have to help it work its way out? It's a system. Get really intriguing.
Yeah, there's that mind, like that gut brain sort of communication that's really important as well too. And just, I mean, I can feel myself get bloated when I go into that fight or flight. I'm super stressed, and then, you know, I'm trying to wolf down my food and my heart rate's elevated, and, you know, I'm not like breathing, and like I'm just, you know, and I know exactly when I get on the other side of it and I have a bellyache, I'm like, well, I mean, you worried yourself into this state. Yeah, for sure.
And it's also, I think, at least here, and I always kind of say at least here, because all I know is like what the St. Louis area is doing. I know some of what Phoenix does, mostly from here. Our physicians don't tell us, oh, you actually need to find out what are your food sensitivities. Because if you have a lot of constipation, you will also have bladder issues. And we see that actually more in kids. The more constipated you are, the bowels that are full of poop press on your ureters, and then always put traction on the bladder. So when we have patients that are constipated, I ask them a lot of pee questions. They're like, why are you asking about my pee? I'm like, because all that's elevated too. It's all so closely related. And we have to dispel myths and tell people that, yes, you should only pee every 2 to 3 hours, and you should poop every day to every other day. It is not normal to pee every hour. Even if you drink a gallon of water, you still should not pee every hour. And that's always really interesting. A lot of people will say, oh, well, I drink a lot of water, that's why I pee a lot. I'm like, well, how much do you drink? Oh, about 40 to 60 ounces. Really? Not.
I feel like that's very common. Like a lot of people, men and women, will say, oh, I drink plenty of water. It's like, how much is plenty of water? Oh, I don't know, a couple water bottles. I drink this container 3 times. I'm like, but do you? And how much is that really? Oh, I don't know. It's a lot. Like, really?
Yeah.
Oh, yeah. I remember working as a nurse and working 12-hour shifts, and I would work with people that just wouldn't drink water because they didn't want to have to take a pee break. And they'd be like, oh, it's been 7 hours. I haven't had a drop of water. And I'm like, oh my God. You know?
Why would you
I
do
was
that?
bodybuilding at the time. So, I mean, it was like, I don't really care. I mean, I've got to get my water in. I will find time to pee. It doesn't even take that long to pee, really, like 30 seconds, you know? But again, that's women taking care of everybody else except for themselves. So, and that is actually why I left that profession, because I felt like there was so much of that. And I'm being very general, obviously, but that was, you know, definitely just, I wanted to take care of people and I wanted to be able to take care of myself. And I was like, I don't know how to do both, but I know fitness is definitely a way that I can do that. And, you know, so, and here I am. But yeah, I wanted to also talk about, you called it DRA. So, and I think I say it wrong. I've always said diastasis recti. Am I
always
saying
botch
it wrong?
it.
It's
a hard word.
a potato. It's like,
oh, is it okay?
Potato, privacy, just how do you want to roll with it?
Niche. I always get those wrong too.
Yep. But that's when 2 things can cause it. The most common thing that causes it is a pregnancy, because a human grows and causes expansion. And then the 6-pack splits. The other thing that we often see, strangely enough, is in older, more obese men. They actually get the same thing just because of that visceral fat that then pushes out at that 6-pack muscle. So a person can have too much visceral fat, and it will cause the 6-pack muscles to split, or more common, pregnancy. And it's just because the 6-pack is attached to the transverse abdominis, and that transverse abdominis opens and opens and opens, and now all of a sudden those muscles just can't touch anymore because the baby's too big. And when that happens, your 6-pack splits. It is very common and even normal to get up to a 1 inch, which is that finger width, diastasis post-pregnancy. But it should go right back down. Within the first 6 weeks, it should close all the way back up. And if not, then we have to tell these muscles, how am I supposed to do this? The craziest one I've seen, it was a full 4-finger. It just did not meet. And then when I kind of dug into the abdominal cavity, I kind of laughed. I'm like, oh my God, I'm fishing all the way down to your spine. Oh, I think I just found it, which meant the transverse abdominis was weak. That 6-pack had split, and we had a lot of work to do with it.
Yeah.
The biggest way to start kickstarting that is a really exaggerated diaphragmatic breath. So when you inhale, you're trying to tell that transverse abdominis, inhale means expand, and then reverse, exhale, pull the transverse abdominals in and not do that setup. So it's just a lot of retraining. Like, you can have a brand new baby, work on breastfeeding, bottle feeding, whatever it is that works for your family, and just sit there, enjoy the cuddles, and inhale, expand belly, exhale, pull the belly in while you're maintaining that posture. Inhale, expand, exhale, draw in, and that gets that transverse abdominis working again.
Because that's that very deep layer of abs. And I think that what happens is that a lot of people will do like traditional core exercises or even weighted ab movements because they can feel it, or like side bends and things like that. And they're completely neglecting that, like the girdle of your core, really, that big muscle. Because we'll often see women that are like lean, like there is no body fat, but they have a belly. And it's because their TVA is just really, really weak. So we do a lot of like stomach vacuum training in the bikini space. Like that's something a lot of competitors do. But would you say there's like certain exercises that would be like a no-no for somebody if they had the diastases?
Crunches. Anything that folds your body up is the no-no. And I have gotten some women who are very competitive and who are very athletic. I've helped them get back into crunches as long as the diastasis doesn't open when they're doing it. So if there's no doming, you're good to go. You can train that diastasis with different planks, with different dead bugs and bird dogs and different sorts of push-ups to help get that to be more solid. And then if the transverse abdominis is solid, those superficial 6-pack muscles, maybe they don't come all the way together, but they don't gap open. And it takes a lot of training and a lot of precise training. And I know you guys have a lot of that same education. We have that education in pelvic floor therapy, but it's respecting what the transverse abdominis does and educating a person on the 6-pack muscle versus the TA.
Yeah.
And
I think it's smart, like what you said, how you can just do it so easily. You know I have a lot of clients that if they can't make it to the gym, or like the gym is the workout, and once you're done at the gym, like your workout is done. But what we find a lot of times is that they're missing a workout, or they're missing a session, or they're missing this because they get busy. Something happens. It's like, well, the gym doesn't have to be the only place you work out. You can do abs at home. You can do stretches at home. You can go walk and run outside, granted weather prevailing. But just like you said, like this is something you can easily work on at home. You put a little reminder in to like do these a few times a day, or, a few times a week, whatever the case by case scenario may be. It doesn't have to be this daunting, difficult task, and you can work on something, and it's a form of self-care, and you can be, at home with your baby, or watching a movie or something and just work on it. You don't have to have like this crazy marked out time away from your family.
Very much.
Yeah, that core strength is so key for like preventing lower back injuries as well, and like other issues in the body. I always tell people like, the core work is not just so that you have a flat stomach. Like it's important to like get those muscles engaged properly to support you when you're doing other like heavier movements like squats and lunges and things like that. But do you often see that, there's like other injuries that come from like a weak core and somebody that maybe neglected to, get their core back in strength after having a baby?
A lot of it can be that lower back pain. And we find a lot of it is from ergonomics. So you've got this little person now, or if you got a little person and another small person, we bend over and we hinge at the hip to pick. And often as you're bending over to pick something up, you're doing that. It's called a valsalva. So every time you bend over, you're pressing down into your bladder, you're pressing into your abdominal walls. And a lot of it is just reteaching people, if there's a shoe on the floor, please don't bend over and grab it, lunge down and grab it, sumo squat and grab it. do what's called a golfer's pickup and grab it. Stop bending over, because that just further makes the hips mad. If your core is weak, actually stepping back. For the core itself, a lot of people don't even realize what that is. The core itself is a little more complex than we realize. So your core is, the top part is your diaphragm. The middle part is a transverse abdominis. The bottom part is your pelvic floor. Then along the back, you have multifidi, which kind of branch out a little bit. Your hip external rotators and part of your glute. All those muscles have to work together, and they need to be trained together. So a lot of people think the core, and they're like, oh, well, that's my abs. No, it's a little bit more than just the abs. There was a body exhibit that was in Vegas many years ago, and it was really cool that you have the human skeleton and had everything dissected out except the true core muscles. And I remember being an athletic trainer seeing that.
Yeah, that's
then
really
you know your gait is cool, because then you see the muscles that you didn't realize that was happening. And once you get that education that you're supposed to rotate from the hip to squat, and that actually helps out your core more than bending over and getting something. A lot of it's redirecting and education.
Well, and that's so fascinating too, when you like to explain that anatomy. Like, that was such a good visual. If anybody's watching on YouTube and they can see like how you were describing everything with your hands, like, and then you grow a baby in there, like, and then to like expect everything to just like go back to normal. Like, you know, I feel like, you know, my nerd brain is like on fire right now. I always do this when we have experts on. I'm always like, oh, I like go on these like tangents, but I just think about that, like, oh my gosh, like, you know, you grow a human inside of this space with all these things going on. Like, you need to give it a little bit of attention on the other side to make sure that it's functioning properly, so you don't end up with a hip issue or a back issue, or, you know, your abs are, you know, not just aesthetically too. I think that's the other thing, is that, you know, looking outside of just what the physique looks like what's going on internally, I think is really important too. And one thing I did also want to ask you about was something we'll often hear from our clients that have had C-sections, one or two or more, is like not being able to engage those muscles. Either they're numb or they just like a disconnect there. So can you explain kind of what's going on there, and then what you can do about it?
Well, I think with my husband and dog just came down the steps. I'm like, uh-oh, who's here? A lot of it is we really downplay C-sections. They're very, very common in the U.S. And in the U.S., we actually have the highest incidence rate of cesarean. Many different reasons on why people think that is, but we don't always think that it's the skin that's cut. And that then scar goes all the way down to the uterus, which is a muscle really, really low in our pubic region. So yes, it's an abdominal incision, but that incision goes to the abdominal cavity and the pelvic cavity. And as then the uterus is kind of retracting and shrinking back down in, then as it's shrinking down back in, that scar tissue is sucking down in with pulse. So that's why a lot of women who have C-sections are like, oh my God, I've got this fat little shelf. It's not a fat little shelf. It's scar tissue threatening your adipose tissue that makes it look fat. But if that incision had some work on it, you'd have a flat tummy, but it's scar tissue. And so teaching women how to get that transverse abdominis moving. And even one of my favorite exercises, you start at a counter and it's a push-up with like an open book and a thread needle, because we need that area to move. Do dead bug, lower abdominal exercise, mountain climbers in various positions, not necessarily at the ground, but to tell your lower abs, you guys have to work and break free. And then depending on some of the physios, I'm trained in dry needling. So I can actually needle incisions to help that scar tissue lay down a little bit better. And anytime we have a surgery, we cut through cutaneous nerve. So you are going to lose some of those sensations. And it takes a loofah sponge, Q-tip, cotton ball, anything kind of scratch, you have to reteach those nerves how are they supposed to work.
That's so fascinating because
That
it's true,
is.
and they just pop you up out of bed like the next day, and you're like, then you got to
Hmm.
take care of a baby, and you've got this big abdominal incision, and it does, like I had two, and I mean it starts here, and then as your stomach and uterus retract, it goes down in there, and I mean it's wild to think about, just expecting everything to like, work back to normal. But I think that's so cool about the dry needling. I had no idea that that was something that,
Hmm.
would help with that scarring, and does it help with the like the sensation and the nerves are in that area as well too?
It does. And one thing that people can do at home, when we look up on some social media, is we can see cupping. We know
Yeah.
cupping. I think it really became popular, like, was it 2002 or 2004 Chinese Olympics, that we saw these giant circular bruises across
Yeah.
everyone. And that is
Yeah.
traditional Chinese cupping, and it does cause a gnarly bruise. What we can do now is grade that suction, and you can actually put those silicone cups that you can get off of Amazon right on the incision because it lifts. And I will teach women how to cup on their own. In Western medicine, we use ASIM, we use Grafton, we use AISIM, but it all derives from ancient Chinese gua sha, which uses the jade stone. You see it a lot for, like, for facing and shrines that we do from
TikTok.
that.
Yeah.
You can gua sha
I
along
have a
your
gua sha.
incision. Yes.
That's so
So
cool.
it's taking that, and even when women get mad that there's like that extra now kind of like fluffy skin that's there, well, the derma roller that you'd use on your face, you can find a little bit longer of a derma roller and derma lower along your lower abs, and that will help tighten up some of that. So we can change it a little bit. Just depends on how much work you want to do.
Yeah, that's true.
And
Wow, that's
so
really neat.
I recommend gua sha and cupping and even derma rolling along. Not, you wouldn't derma roll at your incision, but above and below it.
Mhm.
Yeah.
I never would have thought of that.
And it's
So
just kind of fun
neat.
stuff. And like the derma rolling, I never would have thought of. I actually saw it on a TikTok, and I went, huh, I wonder if that actually works. So I bought a derma roller that has some of the longer needles, rolled it across, and then used my like hyaluronic acid and some of the other skin firming stuff I use on my face. And I went, oh my God, that actually works. So
Yeah,
it can work.
that's so cool. That's awesome.
So it's fun stuff. And it's also
Yeah.
just empowering women that because you had a cesarean, it doesn't have to be the end. But I wish we could do a better job helping women realize that yes, you had a cesarean. Sometimes it was voluntary, sometimes it's not voluntary. And you can get past it, but it requires a little bit of work. And also
Yeah.
giving yourself grace and telling other people that, yeah, you had serious abdominal surgery. You don't blow it off, you take it seriously.
Yeah.
Mhm.
Exactly, but that there's hope that like, there's all these things that you might be experiencing, like there's little fixes for each one. It can
Mm-hmm.
feel overwhelming. I think that there's been a lot of great solutions in this episode. But I also think it's encouraging to know that like you don't have to accept that like this is what's going on. Like you'll always have a gap between your ab muscles, or you'll always pee on yourself, or, you'll have, issues with, whatever it might be. There's all these different solutions and resources. So I'm just
And there
really,
are,
really
and
grateful that we had you today.
no problem. And it's really just nice thing about these women that just because you think you're doing your Kegels correctly, there's a really good chance that you're not, unfortunately. And get to someone, find someone that can help you. And unfortunately, it's probably not your grandma. It might not be your mom unless she's like one of us and knows the field. But plug away and work at it. I get people a lot for a lot, and they've gone to other physios, and it didn't help out as much as they had hoped. And then they can get to me, they're like, oh my God, they didn't teach us this where I was before. Because we all have different toolboxes, and we can all teach
Yeah.
how to work exercise, and the adductors and the hip muscles all overflow to the pelvic floor. So if you just have a strong hip, glute, adductors, you're setting your pelvic floor up for that. So if they're not strong, then the success is a little more challenging.
Yeah. Awesome.
That's amazing. Like all the information is just so fascinating. I'm literally just absorbing all of it. Like I had no idea. I know about the pelvic floor. I know the importance, but the detail and the care and the all the stress, everything. It's so fascinating, and I know it's going to help so many people that are listening. And like we've been talking about this entire time, it's so common for us to keep everything bottled up inside, to just not talk about things, Or if we do say something and then our mom, our sister, our grandma, our aunts, or somebody are like, oh no, that's just how it's supposed to be. It's like, no, it's not. It is not. We can fix this. We can find a solution for this. We can work towards this, and you can be like the best version of you for yourself and for your family. It's just absolutely fascinating. It is.
Yeah.
And it's
I
also
love it.
interesting. So one of the muscles in the pelvic floor, there are several in it, but it's grouped together and called the levator ani. And it's like the rotator cuff. Like there are 4 muscles there, but we just call it the rotator cuff. So in part of the levator ani, it very is much like the levator scapula. We put tension in the levator scapula, and then you lose your neck. And then I'm really like, okay, I need to straighten things back out and relax. If a person notices their shoulders are lifting, so is their pelvic floor. It's like there's this little imaginary line that puts them together. So if you notice you're shrinking up your shoulders, wiggle them out, and then also try to find your pelvic floor and let it relax.
And then
It's all
close
about
your
finding that
elevator
zen
doors, right? That's like such a great analogy.
It's like release the doors.
Hey Mandy, did you close your elevator doors today?
Yes.
I'm gonna get that text tomorrow. Like, did you close your elevator doors?
And it's
First
so
text
funny
you
with
get
like a
from me
lot
in the
of
morning.
how the doors doing today.
Yeah.
We're gonna text you like a week from now and be like, hey, our elevator doors are fantastic.
My door got stuck.
My door's stuck.
And then it's even
Oh
also
my
teaching people like to think of your pelvic floor even as like that elevator shaft. You might not always be able to say, is it open or is it closed? But is your elevator like stuck on the 10th floor? Do you feel that thing is just stuck, or is it actually all the way down to the lobby? Your elevator can get down to the lobby. Sometimes we just have to teach it to do so because we've been storing stress there for so long. It just doesn't know it's capable of going down.
Yeah.
One of my favorite tools is a little thing called the PeriFit, and it is a Bluetooth device. It looks very vibrator-ish, and you insert it, and it actually has like games you can play on your phone that actually teaches you how to better. It teaches you like how to better release your pelvic floor. And I was kind of using it one night, and I'm like, it looks like a Mario Brothers, the one that I was playing, and I couldn't get the Mario Kart to jump over the little tube. And my husband's like, give it here, and he grabs my phone, and he's like, your phone is broke, it won't go. And I'm like, oh babe, you don't have the joystick. And he's like, I'm sorry, what? I'm like, you don't got the joystick,
called?
baby.
I'm putting this in my Amazon storefront right now. Oh my gosh.
I was actually looking at your Amazon storefront, and I need to get with you to figure out, how did you do that? Because I have so many patients say, you have so many recommendations. You need the Amazon storefront. And I'm like, I don't know what that is. I'm old.
Yeah, I'll set you up. Yeah.
That'd be awesome.
It comes in handy because if there's some people that have questions, you can just be like, here it is, here it is, here it is. It's so helpful.
Well, my whole life exists on like trying to help people make things easier. Like that's like my favorite thing to do is like I love hacks and tips and tricks. Like because I live for that stuff. My whole cardio session is just looking for tips and tricks on TikTok. Like it just passes my time. It's so fun. So I love to do that for other people. So the fact that there is this little device that can help somebody, and also I think it sounds like a little fun activity to do as well. So
it is, and it's so objective. Like it shows where your progress is. And if this is your squeeze, it says, okay, you're strong, but you also need to relax. And then if you're kind of weak, it's like, no, there you go. And it just helps you find that out.
Send me the link so I can put it in the show notes because I'm sure.
I was just about to say that. Like that can be so helpful.
I know what I'm going to get you for your birthday, Mandy.
Yeah. And they come in fun colors. You can have one that's pink or one that's green.
They come in colors?
They do.
I just have to keep it for the kids. I'm like, I want to play with that. No.
My daughter, when she was younger, actually did kind of grab something, and I'm like, ooh, honey, not that.
Not that.
Nope.
Oh, that's mom's vagina video.
But there is the PeriFit, and I usually gear my patients towards the PeriFit because it's really the most
PeriFit. Okay.
It's the most inexpensive one on the market. So you can get their last year's model for $120, or the newer model for $140. LV is out there. LV is really kind of cool, but she costs $200. And she is a great market. I don't know why I call her a she. I think it's because it goes in a she. But she's $200. She was actually in the Oscar grab bag like 6 years ago, which is really kind of cool. So I think they were hoping to like promote it, but I think what a lot of stars did is go, and then there's another project out there called the AMI. I don't know a lot about that. So LV and Perry Fit are cool.
Well, maybe get a little sponsorship for Bikinis After Babies for the
Perry
Fit. Maybe they need an ambassador. I love being a guinea pig. That's awesome. I'm definitely gonna try it out. That sounds awesome. And I'm sure there's gonna be people that are listening to this that are like, that's exactly what I'm looking for, like something to help me. So
so we have to put it in the show notes.
And I actually do recommend a lot of my patients get them. And yes, depending on which model you get, it's between $120 and $200. But that also means, like, as we're working together, you're able to have that objectivity out on your own. And yes, it does cost money. And I know a lot of people are struggling with funds right now. But if you have a $40 copay to come see me and you buy that, you can trim back from the visits that you're going to have to see me with. And then we can sometimes focus on more of that core aspect of where is the core insufficient, because you're taking care of some of that pelvic floor tension on your own. I can help fill in. And then it's also fun because I use myself as a guinea pig. So they're like, I was able to do this game, but I couldn't get up there. I'm like, all right, I got you. Try this exercise.
Do it like this.
And then we kind of help figure it out and like, what do we need to do to fill in the gap?
Yeah. I feel like that would increase patient compliance though, because it gives them an activity to do versus just like, now I want you to do 10 of these, or, you know, they're probably not going to do it. But if they have some activity or something that it's just like human psychology that would be more enticing than just some paper homework. So
that and the initial investment. I always like, I really dislike when people for like initial investment are like, oh, I can't afford that. It's like, okay, but listen, if you paid this like little, like it's big, but little amount, like 120, let's say you pay that 120 now and it fixes your problem. Imagine if you don't pay that and you don't get your problem fixed, and 6 months, a year, 2 years later, that 120 just turned into $10,000 in a hospital bill.
Yeah.
Like that's always how I like to explain, like, okay, well, you don't want to, like, you don't see the initial investment in a nutrition plan, but you have money to go out and eat. That's fine. But let's look at your life here in 5 years when you're pre-diabetic and you're having to pay for medicine and a nutritionist.
We always like to say, like, what's the cost of staying where you're at? You know,
that's exactly it. And I'm always kind of intrigued. People are like, well, I don't have time to do this and I don't have the funds. But they're up on all their binge watching. Like, so you had time to watch TV. You had time to, like, what is your screen on your phone? So you spend 2.5 hours on your phone. So go ahead and grab your phone and your PeriFit and pair them together and you'll be great. Like, there's ways that we can kind of trim that back, but we really have to assess, what am I doing and why?
Right. I actually herniated my disc back in 2022, between my L4 and L5, and dry needling and a lot of therapeutic stuff saved me from having to have surgery. And that was what got me. And to this day, I preach this all the time. But if I have time, because I had to go see a therapist and everything. If I have time to watch a TV show, like not even a movie, but a 45-minute TV show, I can lay in my living room floor and do these boring, PT, pelvic floor tilt, hold, all this stuff I had to do for my hips, everything. But I can lay there and do that. And so now it's gotten me into now, like that's when I do my ab routine or my vacuums. And, if you have time to lay there and watch TV, like, all you got to do is lay on your floor and just do this additional things. Like, it's so different and you feel accomplished.
And it's like, for me, I've got a Schwinn bike right in front of our TV. Well, it's actually behind the couch. So often when I get up in the morning, I literally drag my butt out of bed, tumble down the steps, and I will start cycling in the morning because the TV's on. I'm going to watch the news, kind of see what's going on, what's the weather, because the kid's going to ask first thing she gets up. And just a little bit of light movement. And it is bad that there's a water holder on it, and I will put my coffee on along with my water.
It's all good.
Cycle a little bit, get the blood flow going.
I do the same thing. Like, I'm laughing because I literally throw myself out of bed in pajamas, grab my water, and go downstairs in the garage and just like watch TV and do like my cardio just to get it done. I'm gonna watch TV in bed anyways. I might as well get some movement.
My body.
Gotta move.
That's why I was laughing. I'm like, I do the same thing.
Yeah, I do too. Yep.
And I teach my patients, I call it a functional lunge series. Very Tai Chi like lunge. It's a forward lunge, a back lunge, a side, like a rotation. Like, do these. Like, when do you do these? I'm like, either first thing in the morning or the very last thing at night. Because if you do 10 each direction, you're just telling your joint and your blood flow to kind of chill it out. And it's movement. Like, you don't necessarily do a lot every single day, but you at least have to move.
Yeah.
And
Exactly.
it's alarming how sedentary life is right now for a lot of people.
Yeah. 100%. Yeah.
I laughed. I was really proud of
Well,
my cousin. She got a sit to stand desk, and she's got like one of those walkers. So
yeah.
she actually stands at a desk and walks, and then types all of her paperwork.
I think
I
that's
don't know
great
that I
though.
could do.
That's more activity, more steps, and everybody could move a little bit more. I mean, especially when
Mm-hmm.
we get our cold winters here too, and people are just stuck indoors and whatnot. But just walking. I mean, we always say
Walking.
that's like the best form of cardio for sure.
I lived in Arizona for a long time, and I think people are just more fit in Arizona than they are here because it's
Yeah.
great sunny weather all the time.
Yeah.
You want to be outside. Here, winter, I'm like, I don't want to go for a walk today. I need to. I'm signed up
Yeah.
for a 5K next month, and I haven't done enough for it. So I need to like strap on the sweats and go out there. But yeah. But
Well, we have hit an hour. That happened really fast. We could
Yeah.
have probably talked to you all day, Tina. I really, really appreciate your
oh, thank
expertise
you.
and so much great information that you shared today. I really, really appreciate it. So, how can our listeners find you if they are interested in coming and seeing you for therapy?
I work at Mercy in St. Louis. I'm at our Crestwood office, and so basically in our Crestwood office is off kind of Watson and Lindbergh here in St. Louis. The phone number there is 314-965-7171. And if anyone ever has any questions, I am on Instagram, and it's just tina.patti, STL. And send me some Instagram messages. I am on Facebook. I think it's at Tina Patti, but I'm really not sure. I don't
Well, we'll link it
activate
all
my
below
Facebook
for
as much.
sure. So everybody can just click in the show notes and find
Yeah.
you
So yeah, send me an instant message. And if you're not in the St. Louis area, but still very curious and just want to figure out, okay, where can I go in my area? We can help you find that. And it's just making sure that you find the resources, whether it is a pelvic floor physio, if you're still pregnant, or just your alignment's off, helping you find a Webster trained chiropractor, and just helping you find the people, help put you together in the manner that you need. Yeah.
Yeah.
So either tina.patti STL for Insta, Tina Patti for Facebook, or at the office at 314-965-7171. My front office woman's name is Denisha, and she is fabulous.
Awesome.
She runs my life, and she does so very well.
Awesome.
Yeah,
Great.
thank you so much for coming on today. All the information is going to help so many people. And we'll, like Gillian said, we'll have all the information in the show notes below. And there's, you have access to this, via YouTube, Apple, Spotify. So everybody can listen or watch however is the easiest for them. But thank you so much for joining
Thanks.
us
That was
today.
a fun
No,
chat.
thank you guys.
so much.
And I have to say, I am now legit in my daughter's eyes, because since you guys have a YouTube, Mom is on YouTube.
Mom's
Yes.
on YouTube.
I am now a hero. All I had to do was to get on a YouTube to get some kids stuff.
There you go.
Awesome.
Thank you.
Well, thanks again, Tina. Thank you, everybody, for
Thank
listening.
you guys so much.
Yeah, thank you.
All right. You guys have a great day. And
too.
at least as far as my patients, when they're asking, where do I go for some more help? I now know where I will actually be reaching out to you, because I need some assistance, because I've forgotten how to do a lot of things correctly. And I want to go to that next level. So I am going to be plugging you guys to my patients. And once again, I'm like the perfect guinea pig, and we'll try about anything. So
Cool.
hopefully
We'd love
That's
to have
awesome.
you. Absolutely.
Yeah.
I'm
Absolutely.
excited.
Awesome.
So,
Thank you.
yeah, thank you so much, Tina. And bye, guys. Thank you for listening.
Yes.
All right. Take it easy, guys. Thank you.